Hey everyone, welcome to researchmd.com. We got a great topic today. We're going to start, today's topic is like first degree heart block. Again, my name is Pramil. Cheriyath. I'm a program director, internal medicine residency, transitional residency. I'm a director of research and I teach medical students, residents on a regular basis. And let's go to our topic, AV block, okay? Atrioventricular block. What is it? Interrupted or delayed conduction between atria and the ventricles, okay? Three types of AV block we know categorized. This is the first one, first degree AV block, delayed conduction from atria to ventricle, prolonged PR interval greater than 200 milliseconds. Remember, delayed conduction from atria to ventricle and the prolonged PR interval greater than 200 milliseconds. Okay, those are the main thing about it. Now, what are the causes? Could be several causes. You can kind of put them into three different boxes here: structural heart disease, known neurocardiogenic, and toxic metabolic. Let's start with the structural heart disease. Any kind of ischemic heart disease, congenital heart disease, degenerative disease of the conduction system, cardiomyopathy, myocarditis, you name it, amyloidosis, and all of the structural. Even when you do like an intervention like cardiac cath and those kind of things, ablation, and all of this could contribute it. When you talk about the neurocardiogenic, you got prolonged vagal tone, because it could be physiological and or pathological. Healthy individual with when you do like high levels of exercise, obstructive sleep apnea, during vomiting or suctioning or intubation, when you suction somebody for the airway, then those kind of things. Even high exercise. So it's usually it's a benign condition, right? And the toxic metabolic, you got electrolyte disturbance like hyperkalemia is very common, acid-base disorder, cardiotoxic drug, and carbon monoxide poisoning, cyanide, and all of those can also the toxic category. Now, infectious and bacterial endocarditis and Lyme carditis is called like rheumatic fever. Lyme carditis, very, very careful. The complication is extremely high and can easily miss, right? Endocrine, thyroid disease, adrenal disease, neuromuscular, myotonic dystrophy. Now, pathophysiology, when you look at it, there's like a first degree AV block or prolonged AV conduction can have any variety of levels within the heart, okay? It can happen at atrium. It can happen at AV node. It can happen at the bundle of His. It can also happen in the infrahisian conduction system. This is the prolonged, make the prolonged the PR interval and all that. So clinical features, the number one thing, usually benign. Don't worry about it. Most of the time, like 99% of the time, it's nothing you have to worry. Very common, no signs and symptoms. You diagnose, get an EKG, or sometimes then you see it. And the ECG finding, let's go over again. PR interval prolonged greater than 200 milliseconds. P wave associated with the 1-to-1 atrioventricular conduction. So no interruption in the atrioventricular conduction. And so the rate of SA node equals the heart rate, regular rhythm. Every P wave is followed by a normal QRS complex. So they're like a great picture. You see the P wave sitting on the T wave and look at the PR interval, definitely greater than 200 milliseconds. So how do you treat it? Does not require any treatment at all. Unless, you're worsening symptoms or remain symptomatic, then maybe consider like pacemaker or any electrophysiology consult. These are our references. We'll be back with another presentation soon. Thank you so much for watching. Thank you.